Welcome, viewers. Today we're speaking with Dr. Kim from Pondworks Psychiatry and Psychotherapy, a leading mental health practice in Austin, Texas. Since 2012, Pondworks has been committed to treating patients better, offering a unique blend of psychiatry and psychotherapy. Pondworks stands out in their attention to the Medical and Psychotherapy Alliance, an approach that combines psychiatric expertise with psychotherapy to address not just the symptoms, but the whole person. Let's hear from Dr. Kim about how Pondworks is making a difference in mental health care for Austin residents. Hi, Dr. Kim.
Hi, Brent.
So my first question for you is that Pondworks' tagline is, "We treat you better." Can you share how your evidence-based approach combines with your commitment to patient care to create a superior experience for those seeking mental health support in Austin?
Sure, Brent. We treat you better is a little bit general, a little bit mile high. So to boil down on that more, really for us, what makes us a little bit of a unicorn in the delivery of psychiatric care is that we look at both the medications, which is part and parcel with most psychiatric practices, but we spend a lot of time and a lot of attention on helping all our providers, me included, learn and really understand how talk therapy, psychotherapy, how what we call meaning effects affect how well a treatment goes. So, to boil that down, that is treating you better.
Okay. So meaning affects what? Can you clarify what that means exactly?
Well, for all of us, we come in with a history when we see a psychiatric provider. That history could be, for one example, would be previous experiences around mental health. Have we had positive experiences with seeing someone before? Have we had negative experiences? Maybe it's not even us. Maybe it's a family member or a friend. If I or one of the providers here at Pondworks doesn't pay attention to that, it could be we get off to a bad start. And if we get off to a bad start and you don't trust us, that can have profound effects on a treatment, Brent. So by treating you better, we make sure to spend the time. Again, time is a critical element. Talk therapy in some ways equals time. We spend the time to get to know a little bit more of the context of you, and that is better treatment.
Okay, well, thanks for that answer. The next question that I have is, Pondworks has been serving the greater Austin community since 2012. How has your experience over the past decade shaped your practice's approach to addressing each person's unique mental health needs?
So 2012, that's a decade and 2 years. That's been a while
Yeah.
that we've been in practice. And I think some of the lessons learned come from the very beginning mission of trying to look at not only particular type of psychiatric provider who maybe finds an office, hangs up a shingle, sees patients, but doesn't really take insurance, doesn't really include that group of folks, hardworking folks who may really need to rely on the insurance component to help get care. And so the beginning mission of Pawnworks was that we would provide that kind of care that you might get in what we call a fee for service, where you pay the person for the appointment, to give more access to what those groups of patients would get. Okay. So over the last decade plus 2 years, we have been refining that. And in doing so, it's really been a process of learning how to engage in teaching and imparting some of the things that I do to providers who are talented, skilled, show great commitment to what they do, but they need some of those elements of training built in post their school. And I'm talking specifically about providers who are nurse practitioners or physician assistants. So over the last decade, what this is built into is really helping to supervise and train and get really motivated, talented folks to have more skills for them to provide good care. And I really believe that if you are a patient and you come to Pondworks, you will have a really good opportunity at having that higher standard of care, that having these elements of training, supervision, and an approach that has attention to medications. Medications are important, okay? But that's pretty much what you get these days in psychiatric practices. What we add to that is understanding elements of what makes a good supportive psychotherapeutic relationship.
Great. Now, you mentioned insurance, and one thing that many patients appreciate that Pondworks works with many insurance companies, making mental health care more accessible. Can you discuss the importance of the decision and how it aligns with your mission to provide quality care to the community?
Yeah, I think that's kind of springboarding off of what I just talked about in the sense that, take, for instance, playing tennis and learning how to swing your tennis racket, or you take piano and you're trying to learn how to play a piece. Some amounts of learning, actually, we would say probably in both of those, you can't practice once every month for 6 hours and think you're going to be good at it. You
No
have to
way.
do it on a regular kind of, once a week, once every 2 days for 10, 15, 20 minutes. So within psychiatry and psychiatric care, you oftentimes need to have that time to practice, and to practice with someone who you trust and who's helping you through things. I'm basically describing psychotherapy. Okay. Now, for us, sometimes the medications are intimately linked with how you're working on your emotions, what things mean to you, how resilient you are. And guess what? If you can't come in because it's too expensive, then you're not going to necessarily get the best care. When you have insurance, it brings a lot more opportunity to the treatment, a lot more opportunity maybe to come in a little bit more frequently and to be able to afford the cost of good psychiatric care.
So you mentioned the marriage, so to speak, of medication management and therapy. So your website, pondworkspsychiatry.com, mentions that your training informs your care for every patient. So how does this integrated approach benefit patients, whether they're seeking medication management, therapy, or both?
So, with a very concerted amount of effort, I can answer you, I don't know. So, the things we do know are that medication, in how we look at things through metrics and so forth, they offer significant symptom benefit. They offer significant symptom benefit, very much so in early periods of treatment that we measure within weeks or several months. Where things get more confusing is when we extend out the amount of time we look at benefit to a patient. Okay. And when we get to a year out, sometimes things are a little bit disappointing and the benefit starts to decrease. The same is true with a number of the very familiar names in therapy, that we see this initial bump, but then we're not exactly sure that that benefit holds for a long period of time. Our effort here and some research, and trust me, I'm curious about this. I'm sure the whole world is curious about this kind of durability question. There's a little bit of information that the longer you go in a treatment, the more time you allow someone in cadence, shall we say, weekly appointments, that these things stick. Okay. How long that is, it's a little bit different. And I don't want to put out an answer that I'm not always sure of. Sometimes people make what appear to be really big changes within a very short amount of time. And then there are other times where that takes longer. So that's something that is part of what we train our providers to look at, hallmarks and clues that show that someone maybe is kind of getting durable change, that we have more confidence will help that person 6 months, a year, 2 years after completing their treatment to some degree.
So Pondworks receives many referrals from respected medical institutions in the Austin greater area. How does your team collaborate with other healthcare providers to ensure comprehensive patient care?
That's a good question. I think that we do get a host of referrals from some of the larger primary care locations in Austin, some of the OB-GYN clinics, Austin Regional Clinic doctors, and maybe a little bit Scott and White and Austin Diagnostic Clinic. We do find that there are certain providers there that have found us and continue to refer to us. Let's not forget, not just medical referrals come to us, but we get a lot of referrals from therapists in the community as well. Now, in terms of how that happens, I think what happens is that those providers have a need. They need something for their patient. They want their patient to get care around something that maybe they don't feel comfortable with. Maybe they feel a little helpless in terms of how to get this person to move forward, get this person to be in a better emotional place. And, when they follow up with that patient, say 6 months down the road at their annual physical exam a year later, then there's a sense probably that they're still at Pondworks. They're still feeling like their care is being met. And some of those needs are no longer resting on the primary care provider's shoulders. We can bring that in here. Same thing is with a therapist who looks at the meaning effects, at the psychology, but they can't look at medications. They weren't trained to look at medications. And so that is where we help providers who have that need. They likely get feedback and then they refer. Now, in the more short term, we run into a problem that is across the field, which is time. We're in seeing patients, and the idea of finding that one moment with a therapist to communicate, that can be really tricky. But we tried to get around that. We tried to have communication immediately after seeing a patient by communicating back and forth, sometimes trading confidential voicemails to give a sense of where we are with the patient, what we're going to do. And even having that amount of communication, which might seem like a little bit, it can make a big difference in how a case goes.
Sure.
So these are the things that we do to integrate care between whoever's referring to us and what we're doing.
So, what is the state of psychiatric training and how does that fit in with most people get here at Pondworks?
Let me tell you, when I first started in this field, what's a psychiatrist? What's a psychologist? What's a therapist? It can be very confusing. Let's just back up for a moment and say that a psychiatrist is a medically trained doctor who's gone through medical school and then done a 3 to 4 year residency specifically within psychiatry. Okay. Within that, they learn some amount of general medicine. They're required to do rotations within internal medicine, primary care, neurology, the typical medical specialties. Those are invaluable experiences. Those are invaluable moments to learn about human experiences, human suffering, how different illnesses present, how the mind overlaps with the body. So that's really, really important basic stuff. The sad, disappointing aspect is that psychiatric training here and now doesn't take this amazing information base and formally train. We're not doing the best job formally training psychological understanding on top of that within the residency programs. Unfortunately, many programs don't have systematic ways to teach and then to understand what they have taught around psychotherapy. So that's where we are right now, is that guys like me who really believe that to be important, enjoy psychotherapy, oftentimes that is something that is pursued independent of the psychiatric training. What that means to you is that when you go see someone, if you ain't been trained that way, you're not going to think that way. And so you're going to run into a lot of psychiatrists who are really focused on the more what we call biologic standpoint of things, which is looking at symptom checklists and then trying to match that symptom checklist to a particular medication. And then usually a very short comment, oh, therapy is important. Go find yourself a therapist. Here at Pondworks, we think combining those two is often important, sometimes absolutely vital to good care.
Yeah, it sounds like that's definitely the case. Whereas the medical and training education establishment now sounds a little siloed in its approach, whereas Pondworks is trying to marry all aspects of mental health or person's being together for their mental health.
I think that's exactly what we're looking at doing. We see that need and we're trying to address it.
Great. So, what are your thoughts on the current state of mental health care, and how does Pondworks address those specifically?
Let's look at it maybe from a different angle. I'd say maybe 10 years ago, our practice manager and developer looked into the demographics of psychiatrists. And the demographics of psychiatrists, I'm going off of a little bit of old memory, so this will be in the right ballpark. Most were in their 60s. 30-40% were looking towards retirement within a decade. The general US population was already underserved. And now we're having a collapsing of the total number of psychiatrists which are available for patients to access. So that presents an issue at hand in terms of just getting a warm body to be in front of who has been psychiatrically trained. Okay, now Pondworks wants to go one step further than that, meaning that's not necessarily good care just because you have someone who's been psychiatrically trained. We really look at this idea that the combining of, I've used the word before, psychological meaning effects. Maybe I need to talk more about that sometime. But that meaning of what it is to be transparent with someone, to attempt to trust someone, and how then that person helps you, whether it be medications or talk therapy or so forth. So Pondworks wants to address that whole context, not just putting a warm body in front of you. And part of that is that we have this wonderful opportunity with nurses and physician assistants that they have rigorous training, they have motivation, high ethical standards, and with some degree of training and supervision, their abilities and capacities are kind of unleashed in good ways. And that's been a really wonderful aspect, a really kind of growing aspect of my work here at Pondworks is seeing these providers flourish and help people.
And here's a clarifying question. I thought psychiatrists just prescribe medication. Why do you even need to do psychotherapy when you can just go see a therapist? Like are those two things important? And you've addressed it a little bit, but I'd like to address it that directly.
Wow, that's a question I could answer in several different ways. Okay. The first way to say it is you might be right. There are circumstances where many of the symptoms that you may experience, the things that create suffering, they can be addressed, I would say, in, I don't know, I'm ballparking 30-40% of the cases, often just with a talk therapy. And you absolutely can pursue that route first. Now, to answer the second part of the question is that medications do have benefit, and they do have benefit sometimes in certain contexts for a short amount of time, and then you might taper off of it or it might fall into the background of a treatment. Sometimes it's nice to have the reassurance that your provider can interact with you like a therapist, but they have this whole toolkit here in case it's needed.
Sure.
So their capacity to work in broader ways is truly there. Will you need it? Maybe not. Would it just be nice to have it in the background? Probably. Will you need it straight away? Some people might need it straight away. That's one reason that we look at it as indispensable to have people in the mental health care delivery landscape who can do both at the same time. Now, a practical thing to remember is that moment where we shore up the courage to go, maybe we have a problem. That moment where we look at being vulnerable and we look at telling someone about it. Well, not always, but very often the person who is at the receiving end of that is a medical provider, like a primary care doctor or primary care physician assistant. Within that system, for them to refer to a psychiatrist, I really would like that person who's being vulnerable for the first time to go to someone who will know more than just medications, will know more about how to address those things through talk and psychological meaning. That way they don't jump immediately to the prescription pad. They may even, a provider here at Pondworks might go, hey, look, I don't know if you really need me. You might want to go find a therapist in the community too, so that we can also function in a way in which we are sending people to get the most appropriate care for them.
A patient first approach.
I
for
like
sure.
that. Yes. Yep. Yes.